Hello, my name is Lauren Apter, and this is my observation presentation assignment. The video on opening wishes and goals was about the distinction between wishes, which are desires above our control, and goals, which are actionable and within our own influence. He advocates for setting SMART goals, which is an acronym for specific, measurable, achievable, relevant, time-bound goals that are realistic and within one's personal control. The client's behavior was hesitant at first, but then begins to open up when invited to share about personal goals. The counselor uses open-ended question, active listening skills, and empathetic responses. The interactions use strong emphasis to build trust and validation of the client's feelings to encourage discussion about goals. The humanistic theory was emphasized in the video by using positive regard, empathy, and congruence. I noticed a biblical integration by the emphasis of human dignity and free will, which is stated in Genesis 1:27. Something I learned in this video is the importance of using open-ended questions with a non-directive approach and the value of patience. The 3-step emotional change trick used a 3-step technique. 1. Name the feeling. 2. Describe the situation. And 3. Identify a positive exception or coping success. The client behavior displayed frustration and emotional heaviness and began to shift into a more hopeful thinking throughout the guidance. The counselor stayed calm while validating the feelings of the client. Positive reinforcement helped the client feel heard and empowered. A cognitive behavioral theory technique was used and reflected the principles within emotional regulation. Zangrilli et al. 2021 supports the approach by highlighting how CBT frameworks help respond to patients' emotional cognitive expressions. Philippians 4:8 highlights the emotional awareness that is compared with truth-based thinking, like this video shows. Something I learned is how simple structured interventions can help to produce emotional improvements. Also, how reinforcement of emotional insights and cognitive reframing can be taught in a gentle and respectful manner. In the video, Claire, What's So Good About You? The client shows low self-esteem and difficulty noticing their own strengths. She also seems emotionally guarded. The counselor uses very strength-based questions and reflective listening that helps highlight positive traits that Claire does not recognize in herself. The interaction had a slight shift when Claire began to realize her positive quality, while the counselor's affirming tone and patience helps to break that self-resistance Claire has. Strength-based counseling was shown by using the counselors focused on Claire's positive qualities that were rooted in strength-based and culturally sensitive approaches. This helped with the restoration of self-worth and resilience. Orang et al. 2023 also demonstrated this application, especially within the populations facing emotional vulnerability or also in identity changes similar to how Claire struggles with their low self-esteem. The biblical integration I noticed was how this approach is similar to what we see in Psalm 139:14, and how God affirms that every person has their own intrinsic values in goodness. I learned how the power of affirmation and validation can overcome self-criticism in any situation as long as the person recognizes it in themselves. In the video, Claire closing and summary, Claire appears to be more open and self-reflective by the end of the session. She is also able to verbalize her insights and accepts the affirmations from the counseling sessions. The interaction ends with warmth and a sense of closure, knowing that there is a noticeable shift within Claire's self-perception as she has made more clarity and empowerment. The counselor uses many affirmations to strengthen and strengths to consolidate Claire's progress. The counselor uses narrative therapy by using Claire's insights to reinforce and empower self-narrative. Rang et al. 2023 also found that valuable-based counseling helps clients take another view at their life experiences and find new techniques that affirm dignity and promote a more positive self-reflection. Jeremiah 29:11 reflects on this video by highlighting the act of affirmation and how it connects to biblical truths. I learned the importance of intentional closure as Claire was able to summarize progress and a sense of completion, and how it was encouraged to use client language to reflect back on their growth. In the video, TJ Anger Management, TJ shows a lot of defensiveness and frustration while discussing his anger and shows lots of tension throughout body language. The counselor always uses a calm approach while helping to explore his expressions of anger. The interaction between the two shows trust through validation, and TJ eventually becomes more reflective as he understands that he is heard. CBT is used again throughout the video by putting emphasis on the recognition between thoughts, feelings, and behaviors. A biblical perspective that invites clients to see their heart behind all of the anger relates to Galatians 5:22-23, as it pursues peace, forgiveness, and self-control. In this video, I learned that anger management is most effective when you are not shaming and focusing on their values. In the video, Lewis Motivational interviewing the client's behavior appeared to be uncertain about making changes in his own life, and as he voices having mixed feelings about his current habits and future goals. The counselor demonstrated motivational interviewing techniques by using open-ended questions, affirmations, reflections, and summaries. The interaction between the two fosters a collaborative atmosphere where Lewis feels the need to consider change, but on his own terms. Motivational interviewing was used by expressing empathy, supporting autonomy, and eliciting change talk. Fried et al. 2022 found that MI-based interventions increase engagement within challenging behavioral areas. Romans 12:2 is highlighted throughout this video as it encourages clients to reflect their own values that mirror the biblical principle of heart transformation. I learned how effective it is to evoke rather than impose motivation, and how small shifts in language can foster a deeper client engagement. In the video sample CBT session on social anxiety, the client behavior shows avoidance, negative self-talk, and the fear of judgment within social settings. The counselor's behavior is very structured but also supportive by modeling calmness and clarity. Together they build collaborative problem-solving dynamics, and the client eventually engages more in identifying distorted thoughts. CBT was also shown in this video by the counselor helping the client to identify automatic thoughts and considering more adaptive thoughts. A biblical worldview that speaks to this video is Galatians 1:10, by identifying worth and offering reassurance against the fear of man. In this video, I learned how effective structured tools are in managing anxiety and how I can use collaborative goal-setting techniques to help navigate through social fears. Lastly, in the video mental status examination, the client presents emotional dysregulation and disorganized thought patterns. The counselor's behaviors use structured format to assess the domains that included appearance, behavior, mood, thought process, cognition, and insight. The interaction between the two had a calm tone to help reduce discomfort, which helped the client participate openly. The mental status examination was used to serve as a tool for understanding the client's current psychological functioning. Bzurdik and Greiner 2022 highlights the importance of structured diagnostic tools like the psychodiagnostic chart for less experienced counselors. This supports the idea that all professionals can receive valuable, reliable insights when using structured frameworks. The MSE highlights the biblical principle of wisdom in the understanding, as it does in Proverbs 25. In this video, I learned how to use the MSE to gain a more holistic clinical understanding without having to sacrifice rapport, and also to reinforce the need for structured observation and documentation always in a professional practice. These are my references. Thank you.